This is the ProbeOne, an advanced new way to harness the power of your computer for periodontal probing and charting. The ProbeOne consists of an interface unit, an encoder handpiece, disposable probe tips, a foot pedal, and a number of other accessories. Connected to your Windows computer, the ProbeOne works in conjunction with perio-charting software to automatically measure and record pocket depths and other perio data. In fact, the ProbeOne is compatible with more than 50 different practice management software packages. Instead of a metal tip, the ProbeOne uses a gentle, flexible fiber to enter the sulcus. It applies a uniform 20 grams of pressure, providing readings that are consistent and reproducible no matter which member of your staff is doing the probing. By automatically recording the data, the ProbeOne allows a single staff member to perform a complete perio exam as quickly as 2 people using conventional probing. And just as importantly, the ProbeOne allows your computer to provide voice feedback, calling off the probing depths as they are recorded. Would the ProbeOne be a valuable addition to your practice? Perhaps the best way to discover the answer is to hear it straight from dental professionals who use the ProbeOne on a daily basis. Listen as Dr. Brian Raskin of Valley Stream, New York, and his hygienist, Marcia Rothman, share their experiences with the ProbeOne.
I've been using the ProbeOne in my office for a number of years now, and it's very advantageous in presenting periodontal disease to the patient and also reinforcing the fact that they do have disease or that the mouth is healthy. There are a lot of advantages of using the computerized periodontal probing system over just hand probing, and one of them is the computer actually calls off the numbers of the pocket depths as you do the probing. Why this is an advantage is the patient has a tendency to believe the computer better than they believe the doctor or the hygienist. Before we start the exam, I explain to the patient that pocket depths of 1, 2, and 3 are healthy, that 4, 5s, and 6s are possibly problems, and 7, 8s, and 9s signify a lot of bone loss. I also tell them that if you have minimal pockets of 1, 2s, and 3s, but there's bleeding present, that could also mean you have forms of periodontal disease. As I do the exam on the patient, they actually hear the numbers being called off for each pocket. When I'm done with the exam, the patient normally comes back to me and says, I heard 4s or 3s or 7s. I have a problem. What are we going to do about it? That type of reinforcement is worth a lot to my practice. I no longer have to convince the patient that they have a problem. They are now coming back to me and asking me, how am I going to help them?
I do find the ProbeOne easier to use. I've gotten used to the system and find that the patients are less sensitive than using the metal probing, and also that they can hear the readings. And when I explain to them what the numbers mean, they know immediately what their readings are and their condition is.
Very often we spend much time trying to educate and convince patients to go ahead with treatment. The ProbeOne is a big advantage to my practice because my patients are very readily going ahead with the treatment that I recommend. They benefit from the periodontal treatments. They have healthier mouths. I benefit because my patients are more compliant. They return for their follow-up visits more readily, and the general health of my practice is better.
And it makes me feel very satisfied that I've done my job and explained to the patient what's needed, and they're receptive.
Recently, there's been a lot of documentation in the media that periodontal disease is related to heart disease, diabetes, and stroke. And by documenting the fact that they do have some periodontal disease, keeping their chart present, and discussing it with the patient, these links can be addressed early, and prevention of these possible lethal problems can be prevented later on in life. Other things you need to remember about probing with the ProbeOne is that it gives you a routine reproducible 20 grams of pressure on every probe. The advantage of doing that is that between each visit you probe, you're always probing with the same amount of pressure. So that if your hygienist probes a patient and then you probe a patient, there's no difference in the probe pressure and the pockets should be reproducible. This is different than hand probing with a metal probe where the doctor's hand might be heavier than the hygienist or vice versa, and the numbers might not be accurate. Many dentists ask me, why should I make this type of investment into a periodontal probing device when I can still do it by hand? There are a lot of advantages that I see to my practice that have improved my bottom line tremendously by incorporating the ProbeOne into my routine examinations. Because the periodontal probing can now be done by one person, you don't need an assistant to write down the numbers, or you don't need to take the time to probe and write and probe and write. Every single one of my new patients is periodontally probed. We incorporate this into a comprehensive oral exam, and the fee is part of that comprehensive oral exam. Before, we routinely did full mouth periodontal probing with the ProbeOne on all of our patients. That includes the new patients and the recall patients. A regular adult prophy was normally the treatment of choice. Possibly we did a full mouth scaling, but very rarely anymore. Now that we are full mouth probing with the ProbeOne all of our patients, we're finding a lot more periodontal disease. This periodontal disease needs to be treated much more aggressively with 4 quadrants of deep scalings plus irrigation, and we irrigate with chlorhexidine. In our practice, the usual and customary fee for deep scalings is $125, plus we add $25 for the irrigation with the chlorhexidine. If you figure 4 quadrants of deep scaling plus irrigation plus a follow-up prophy, we've added $500 for the deep scalings, $100 for the irrigation, and $60 for the prophy, which gives us $660 per patient to get their mouth back to health. If you can figure that we see probably 4 or 5 patients a week doing soft tissue maintenance, which is about 20 patients a month, this very quickly can improve your practice bottom line and definitely justify the purchase of the ProbeOne. I find the ProbeOne very helpful in risk management because it really helps explain to the patient what their disease is. I find that you must explain everything these days. Whatever you're doing on the patient, they need to understand. And just as we're doing the probing, since the computer gives you voice feedback, by the time the exam is done, they've already been informed to the degree of their pocket depths, and after explaining what that means, the degree of their periodontal disease. Also, we routinely print up a chart of the periodontal probing after the exam is done. We put a copy of the chart in their paper chart, and we also often print up a copy and make notations on it where the problems arises, where their pocket depths are, and give it to the patient and let them leave with it. By doing that, they have something to take home that reinforces the fact that they do have problems if they're present, and reinforces also that they should be coming back to follow-up treatment. 48% of malpractice cases are because of periodontal disease, and by having a dental periodontal charting present in their chart, documenting that the pocketing was done and that you discussed it with the patient, you're really decreasing your exposure to this type of lawsuit. Very often insurance companies need copies of periodontal probing when you submit any procedures for deep scalings or periodontal surgery. It's very easy to push a button on the computer and reprint their periodontal probing. It also reprints any bleeding points if they're marked, and pocket depths. Since this is so accessible, we have cut down the problems with insurance paying for procedures, and we have streamlined our insurance processing techniques. When you do hand probing and writing down the numbers manually, there is a greater chance of error of rewriting wrong numbers or not being able to read the numbers. With computerized periodontal probing, the computer doesn't make mistakes. If it records a 3, it marks a 3. If it records a 6, it marks a 6. cutting down the middleman in this situation does give you more accurate documentation. After a week or two, you will notice that your speed will increase tremendously, and there's very little discomfort to the patient. I find there's actually less discomfort to the patient using the Probe 1 than with a metal probe, because you're only applying 20 grams of pressure. There are a number of areas in the mouth that are a big advantage in using the Probe 1, and I find that lower lingual is one of them, because this is a very difficult area to see. Turn towards me again, Lisa, a little bit. Here, you can actually just place the tip, make sure it's seated, and press the pedal. And you don't have to read the lines off on the periodontal probe and see what the numbers and the depth are. Computerized charting gives you the ability to do something you cannot do by hand very easily, and that is compare 2 different or 3 different periodontal probing visits to each other. By being able to get a single printout with the 2 or 3 different visits on it, you can then go back to the patient and explain to them how your treatment has helped them, that possibly in 1 or 2 areas of the mouth they have had tremendous improvement, or in 1 or 2 areas of the mouth there's no improvement or areas are worse. This then can then help you in deciding what future treatment will be and what type of maintenance that patient might need.
So now you've heard, doctor to doctor, hygienist to hygienist, the benefits of using the Probe 1. Your next step is to experience the Probe 1 for yourself. To find out how you can try out the Probe 1 on your own patients, call